Let's talk about the lymphatic system, which is very important for your health. When we talk about rasa dhatu as being blood plasma, it may even be better to think of rasa dhatu as lymph. It is lymph, but think about the ancient people who are designing the Ayurveda system. If a person got a cut, they would see blood flow, and that was called rakta. But if a person had a blister, they would see that this plasma would leak out, or the lymph would leak out. Like if you have poison ivy, you see weeping wounds, and the lymph is coming out. And it's natural to think of the lymph and the rakta as separate tissues. Obviously, in modern Western medicine, we know that blood contains both rakta and lymph, right? It contains the red part and the lymph part as well. So there's some overlap there. But let's go over this concept of lymphatic congestion. Generally, lymphatic congestion is a stagnation in lymphatic flow, and it's caused by thickening of the lymph, and that thickening comes because of rich, sweet blood plasma. And the Ayurvedic technical term for that rich, sweet blood plasma is rasa dhatu vriddhi, and it's a complication of kapha disorders. So thickening of the fluid obstructs the flow. The lymphatic system is a network of vessels in all bodily tissues to drain your lymph. And it washes away metabolic waste products from cells. And if your lymphatic flow is disrupted, then those metabolic wastes will accumulate. So every cell of your body is producing those metabolic wastes. They're called mala, and a buildup of that mala creates a condition of ama, right? So here on the slide you see the word ama being used, but the technical term for these metabolic waste products in Ayurveda is mala, M-A-L-A, and mala. It's normal to have some mala. It's normal to have these waste products in the lymphatic system. But if the lymphatic flow is disrupted, then it builds up to a point where those wastes become very irritating and cause inflammation, and that is an ama condition. So kapha foods can cause that, as I mentioned, making the blood rich and sweet. Tension in the muscles can also cause poor flow of lymph. That's why we're going to be looking at those two different areas, kapha aggravation and tension, when we're looking at lymphatic congestion. So if your lymph is sweet, by the way, bacteria and fungus will grow quickly in your lymph, and then you'll be more susceptible to infections. That's why kapha people in general can get infections, because their blood's so sweet. If your lymphatic system is congested and stagnant, then you're going to have low immunity, because your immune system's in the lymph, and it needs that constant flow to get the white blood cells and the immune system to that area. I mentioned previously that lymph is closely related to rasa dhatu and rasa vahashrotas. So refer to the rasa lecture for lots of details regarding the lymphatic system. Sometimes dehydration can make flow sluggish too. So if you don't have enough fluid in your system, it won't flow well. And any imbalance of any of the three doshas can affect your lymph. In fact, it does affect your lymph, and therefore it affects really your whole body, because your lymph bathes every cell in your body. The main remedy for lymphatic congestion is reducing kapha and maintaining good hydration so that you're flushing out the system and you're keeping the fluids thin. Other great ways to ensure that your lymphatic system is moving is by taking a full breath. Every time you take a breath, on the inhalation, it creates pressure on the lymphatic system that moves those fluids along. A daily stretch keeps your lymph moving. Exercising keeps your lymph moving. Getting your heart rate up keeps your lymph moving. And there's also a technique called lymphatic drainage massage, which you can refer out to people who specialize in this if you have a client that has congested lymph. And how are you going to know if you have a client that has congested lymph? Well, when a person has lymphatic stagnation, you see that their skin looks red and puffy. You know, if it's not red yet and if it's just puffy, there may be stagnation. But as soon as those malas, the metabolic waste products, build up, it starts to create some inflammation, and you see that the skin looks red and puffy. Diuretics like celery and parsley are really good to flush your fluids. Vasodilators and diaphoretics improve blood flow, which improves the flow of the lymphatic system. So there I'm thinking daikon and garlic are two great food vasodilators. And then you have your cardiac stimulators to get the pump moving. Horseradish, jalapeno, and mustard. Among herbs, punarnava is one of my top choices because it's not only a diuretic, but it's also a heart tonic. And that makes it, I think, really good for lymphatic congestion. CCFT, also good because it's a vasodilator and diuretic. Here are some herbal vasodilators and diaphoretics that will improve circulation as they dilate blood vessels. And that includes turmeric and holy basil, or tulsi, also known as tulsi. Your cardiac stimulants in Ayurveda, trikatu and cinnamon. And your anti-inflammatories, as well as blood cleansers, are going to be important for the lymphatic system, like manjista and neem. All right, what about when you have swollen glands in your lymphatic system? So here's a picture of the lymph nodes of the neck. And you'll see that, and you've probably heard of this before, people will get swollen lymph nodes, and some of those lymph nodes will be as large as a marble, or maybe even a little bigger than a marble, an almond or something like that, and they can get a little tender and painful. Glands in general get swollen when there's an infection or a virus, or it could be cancer too, right? Cancer in the lymph node will cause it to enlarge as well. But the typical case is infection with bacteria or virus, and then the lymph nodes fill with cells and fluids to fight the infection. The enlarged lymph node is an important diagnostic tool because it tells you where the infection is. The enlarged lymph node usually comes in close proximity to the infection. General inflammation and also autoimmune diseases like Hashimoto's can cause lymph nodes to swell. And as I mentioned, cancer. So Kimberly tells a story about her dog having cancer. Initially, the dog had no other symptoms besides an incredibly swollen lymph node on her neck. The vet treated her with a strong round of antibiotics, which did nothing, and then diagnosed her with a lymphoma, to my disbelief, Kimberly's disbelief. My dog's health gradually declined, and she passed away 6 months later. And that's sad. So swollen glands come as a combination of things. So it could be that that a person has low immunity and getting an infection because they're too deficient to fight off disease. You know, if you're staying up late at night, skipping meals, and generally have a Vata constitution, your immune system is going to be too exhausted to fight the infection. then you'll get an infection. Kapha people, their lymphatic system is so sweet, their blood is so sweet that it's very attractive to infection. And then, of course, if it's thick and not flowing well, then the immune system has a hard time getting to that area, which gives an opportunity to bacteria to infect. Usually, or often, ama is associated with this pathogenesis. So we'll have deficiency, or we'll have kapha sweetness, and then that plus ama. And the ama is irritating just enough that it causes, ultimately, infection. Swollen glands, by the way, are called knots or granthi in Ayurveda, and especially in TCM. And I think TCM really develops this understanding of how to, of knots, this concept of knots, it really fleshes it out. But you want to refer out to the doctor to fix the underlying cause of the lymph node. Don't fool around with that. Just refer out to a doctor. Then they can do massage, including self-massage and professional massage. They can take antibacterial or antiviral herbs or antimicrobial herbs to combat the infection, or blood cleansers to clear ama. Poultices are especially helpful for swollen glands, and especially a poultice with an aromatic herb to disperse fluids, or anti-inflammatories as needed. Some laxatives might be helpful if you need to clean out the ama, because that can help the person overcome the infection. There are 8 main groups of lymph nodes in the head. You can pause on this slide and review them. But I just want to show you some of the pictures. There's a lymph node in the back of the neck. Other lymph nodes further up near the ear. The parotid lymph node here, you see is bulging. And here are some of the other different areas of lymph nodes. And same thing again. You can take a look at these slides, pause on any one of them to check them out a little more.